This section consists of patients describing their experiences in their own words. Please note that any management or treatment suggestions made in this section is the individual's own opinion and does not necessarily reflect good clinical practice. If you are in doubt about any aspect of your care, you are advised to contact either your own doctor or the hospital specialist team.
I'm Eric Williams. I was diagnosed 7 years ago with bowel cancer, and fortunately I caught it very, very early on.
What were the symptoms that you had?
I thought I had piles, to be perfectly truthful. I went down to see my GP, he examined me and obviously recognised it straight away and sent me straight up the hospital. I saw Mr. Joseph, who examined me and confirmed it was cancer. But it was very, very small.
What was the level of care like and the treatment, and how did that go?
I can't fault it. You know, everything moved very, very quickly. I've dealt with cancer patients for, about 20 years, taking them back and forth to the hospital, and I've seen the success of the treatment. So it honestly didn't frighten me.
What were the concerns that you had when you were told that you had bowel cancer? What sort of questions did you ask?
Would it be reversible? And unfortunately, it's not reversible in my case. But it's something you learn to live with. That it's no big deal, really. You know, I go on holiday, I go out for a drink with the boys and a meal, and that's it. That's what I'd done before. I think I was back driving within about 5 weeks. I had to do it because, unfortunately, a week after I went home, my wife was brought in with a heart attack. So that left me on my own, and, you just got to do things. So I think it's about 5 weeks I was back driving. I don't want to be ill. Don't want to be an invalid. And I'm not an invalid. I'm 82, and I think I've got a few more miles under the clock to go.
And now, 7 years on, how are you?
I'm still driving.
The problem was, every time I went into the shower, I was bleeding from the back passage. And I left it go for a couple of months without bothering nothing at all. Then I went to the doctor, and the doctor then referred me on to the hospital.
We didn't know at that first point whether it was cancerous or not, because until he actually had part of it removed from him and sent for an analysis, we didn't really know what the outcome was going to be. And it was only when we came back for a further appointment that it was confirmed that there was a slight cancerous polyp there, which needed to come from there, obviously ASAP.
How did you feel you were looked after by the staff here?
It was absolutely fantastic, especially Mr. Professor Ray and all the medical staff. They was A1, couldn't fault them at all. And it's not the first time I've been in here for the operations. I've had quite a few operations with Mr. Ray, quite a few.
So you had your money's worth out of him?
I had my money's worth out of Mr. Ray, and he's absolutely brilliant. With us men, we're in 1 year now, there. So there's the spokespersons. So anything I want to know, they tell her,
Alan sort of homed in on the main thing, cancerous bump. That was the only thing he used to take in. I used to take the rest of the information on board. We used to go home, and when we'd calmed down and he'd have a cup of tea and settle down a little bit, then we'd sit down and I'd tell him exactly what they said that was there, what they said they wanted to do or what they would have to do, and this type of thing. And of course Professor Ray, Tony Joseph, all the team in endoscopy, they were always there for us whenever we went there. They were always a lot of bundle of laughs, shall we say. They were really, really wonderful. And they were always there for us.
It took me quite a long time to get on my feet. I'm feeling back to my normal self. But once you're back to myself, and you're on top of the world in here, which I am on top of the world now after the operation, which I have had. I've had quite a few operations up here with Mr. Ray, and now since I feel 100% better than I used to before, look. I feel really, really great with it. I know I got it for life, I got the pouch for life, but I absolutely feel great. I can do anything. I do gardening, I like singing, so I do a bit of singing as well. So I'm back to normal.
it hasn't affected us in any way, to be honest. I'm used to it. I got used to it from the very first day that I seen it in hospital. I hadn't seen one previously to the operation, didn't know what to expect. All we knew that there would be a stoma there. So I was a bit, when I seen it, because it's quite red and like we
it's
call
like
it.
A cherry,
it's a cherry, we call it.
Cherry, I call it.
So it is like a cherry. And once we'd seen it once, it was there, end of story, get on with it. So it's not affected us in any way at all, to be honest.
I don't hold anything to myself. I tell people which I've got a pouch. So I'm not afraid to tell anybody. Wherever I go, if I go out and have a pint with the boys, I tell them everything all about it, and everybody knows me. I don't hide anything from anybody. And if I knew that you had one, I'd help you and tell you all about it as well. Like the easiest way that I think to go about it, how to put it on and take it off. Like.
What do you think of the idea of producing a DVD that has information on it?
I think it's outstanding. We've always said that.
Yeah.
For the last 3 years since I've been coming back and forth up here, I've always said that it'll help somebody else. And if it'll help somebody else, all well and good to it. Because you don't know what you're going through until you've had it, and then you've got to put your mind and think, right, that's it. I've got to live with it for the rest of my life and just carry on with life. And don't be afraid, it doesn't catch anything, or you can't catch anything off it. You've got to live your life normal, haven't you? You mustn't be afraid and sit in the corner. When I came out of hospital at the beginning, when I was sitting on the toilet, which you said you wipe, you walk in front, all your body's in the front, so you wipe and you behind. That was the hardest part, because I should have been sitting back, like the wife said, I should have been sitting back and then dropping it down there. But I didn't think of it because I've always done it.
Of course.
Yeah. So little things like that. I picked up a lot of things myself, and when I've come back onto the ward, I've always told the other patients, helping them.
You will find your own way of working around things, but these are one or two different ways of how you could cope initially, but you will find the best way. And an example of that would, like Alan will tell you, on how to go to the toilet when Alan has a drainable pouch, but how to go to the toilet with a drainable pouch, which is different to standing up and having a wee, like most of the men on the ward that Alan found out were trying to do. Obviously with splashes and everything, and it can be quite difficult for you. So what Alan used to tell them is to sit back on the toilet and leave it come to the front in between the legs to empty it that way. And they were ever so grateful that they were able to think, gosh, what a good idea, that was fabulous, Alan. And they just felt quite relieved that it was an easier way to manage a drainable pouch. And this is why we found, when we heard about the video, that we thought, this is a fabulous idea, so it's little tips and hints that I think may be included as well on this, which would help other people.
My name's Robert Crais. I live locally at Merthyr Tydfil. My cancer was diagnosed in early July 2008. I went to see my GP after losing weight quite rapidly, and my visits to the toilet were out of sequence and whatever. So anyway, cut a long story short, I went to see my GP, referred me to see Dr. Masood at this hospital in Prince Charles. After endoscopes and the cameras and whatever, they decided that I did have a tumour in my rectum. So anyway, August the 11th, 2008, I had my operation to rectify this horrible thing. And anyway, the operation was successful. The assurance of the medical staff was outstanding prior to the operation. I was assured that everything would be all right as best they could and whatever. I was in the operating theatre longer than I thought, so I came back, and there again I had the best of care on the ward that I was in. And slowly but surely I made the recovery. As I say, this was August the 11th, I had the operation, which was on a Monday. On the Friday, I was asked did I want to go home because I was doing so well, which I did feel very, very well. I went home, but anyway, unfortunately, things took a turn slightly for the worse. On the Sunday, I was home, so I phoned the hospital and they told me to come back in. And what had happened, I picked up a slight infection. So anyway, I was back in hospital on the Sunday evening, and then on Monday, then they started treating me and whatever again, and I lost quite a lot of weight in a short period of time. But thanks to Dr. Masood and Dr. Crais, they diagnosed what it was. I picked up an infection in the kidneys, it was. Nothing to do with my cancer or whatever. So anyway, after a couple of days or whatever, they started feeding me on drips, and I had a blood transfusion, and I really felt good. And basically, the care and everything I had was absolutely wonderful, and this is where I am today. I'm going this far down the road now. I'm waiting for reversal. I feel fighting fit. I feel as well I could take Joe Kolzaki on, to be perfectly honest with you. But it's keeping fit, it is. But at the moment, I feel really good, and it's all down to the staff of this hospital, and I can't thank them enough. And if anybody else is in the same boat as me, has got this horrible thing, if you come to this hospital, you'll have the best care, and I'm sure that you will make a recovery like I'm going to make, because I know I make a recovery, because I feel so good about it.
How did you feel when you were told you had cancer?
Devastated, to be perfectly honest. It hit me like a bolt from the blue. But yet, prior to that, I knew there was something wrong. So when I was told, it certainly wasn't a relief, but it started me on the road to recovery then, if you want to know, because now I knew there was something wrong, then these people could do something about it for me. So in one sense, it's something I didn't want to hear, but it was something I'm glad I did hear about. Otherwise, I wouldn't be here today. Everything since then has been uphill. Touch wood, everything has been uphill. I haven't looked back since. I went down to 11 stone when I was at my lowest ebb in the hospital. As I say, I worked my way back up, and at the moment now I'm just short of 14 stone. And, I'm putting on weight now, but I'm started now from about a fortnight ago. I started now going back to where I was before, where I'm watching now what I'm eating before. After the operation, I lost so much weight. I was so conscious of the weight I'd lost, which is silly, really. But I was just eating anything, and I was eating as much as I could. This thing about my face was drawn, clothes are hanging on me. So I decided to put some weight on, but I was silly, really. I was eating cream cakes and stuff like that, stuff we shouldn't have been doing, but as I say, the weight part of it got to me. But I'm back on now, eating the sensible food and whatever. And I just just sitting and waiting and hoping that somebody would knock at the door and say, next week you can come in and have your reversal. That's my only delay at the moment now, because I am eager to go back to work. Like, in all modesty, I'm trying to tell you, I think I cope with my diagnosis fairly well. I got a marvellous wife and she coped with me, but I know there's people out there that haven't got wives, are on their own and whatever, and are still got to cope with this thing. And I think they can play that DVD over and over and whatever it'll be, and I'll tell you what, it lets them know exactly what's in front of them, and I can assure them, whoever's watching the DVD, that it's all good news, and it'll settle them, and it'll be a real good thing for them.
And how have you been coping with stoma? And
in the beginning, to be perfectly honest, I found them very frightening. You're frightening to move, you're frightened to sit down crouched, anything that would move the bag, I was frightened to do. But I can assure anyone, don't be frightened. The more relaxed you are with it, the better off you are with it. And I get my odd little breakage and spillage and things that are bound to happen. And 9 times out of 10, that'll be down to me because I haven't fitted it tidy. So, yeah, I'd say that I'm coping quite well with it, and I'm not bothered at all about it now. I got one fitted beer, and it's like, it's not there. It's not there at all. The actual changing of the bag is so simple. As fast as I could tell you about it, I could do it. That's how quick it is. It's so simple. And it's marvellous, like, you know.
You talked about this hospital and the team, the surgeons, the staff. They looked after you.
Oh, second to none. If I could win the pools tomorrow, I'd take them all on holiday on the weekend. Yeah, they were marvellous. From Dr. Masood, Dr. Crais, and all his staff. The ward staff, Maria Price, and all the other staff on Ward 1 and Ward 2. Just out this world, people don't appreciate how much they go through. If you have an accident, what I mean by an accident, your bag should leak or something like that, and it goes on a bedclothes, they don't mess about, they're there. Their number one aim is to make you as comfortable as possible, and they're just marvellous, marvellous people. I think they're wonderful. If you don't feel well in any sort of part of your body, if you don't feel well, especially in my experience, my bowel, if you think there's anything wrong, go to your GP straight away and see if you can get referred to see these marvellous people up here. Because always remember, I'd rather have this bag here and wearing a body bag. Always remember that.
I'm John Abbott, and I didn't have a clue that I was ill at all in any way until I stayed a few nights with my partner here, also my carer, for a few nights I stayed. And during the night I went to the toilet and I passed quite a quantity of blood. That in turn, I went into shock and collapsed. And Mary, here my partner, called the paramedics in, and everything went from there. The treatment I had after the paramedics had finished with me, I was taken to the ward, and then it was diagnosed that I had a problem inside. So that's how it all started. And within a few days, I suppose it would have been, I was in hospital having the camera and scans done. And from there, another few days, and I had the operation. Which, to my way of thinking, was really successful, because I was out of hospital within 4 days, walking about. 2 days I was out of bed walking about. So, you couldn't get it much better than that, could you?
When he seen Mr. Crais, he had doubts about, oh, will I have it or will I not? And I said, well, there's only one thing you've got to do, is if you want to live, you want to have it.
So what were your fears?
Well, Mr. Crais put me right on that. He said, you've got it. And what is more, he said, it's not going to go away on its own. You've got to get rid of it. Well, apprehension was one of the things, a lot of apprehension. But when you weigh up the consequences of not having it done, well, it was really ludicrous. You had to have it done. So that was it. I just accepted it and said, okay, well, let's go ahead and do it. And it went from there.
Do you remember coming to a point of acceptance where you were reluctant before, but then you just said, right, I'm going to do it? Do you remember making that decision?
Yes, I did. It went like this. My son was with me as well, and Mary. And my son put the question to Mr. Crais. He said, well, what about if he doesn't have it done? And Mr. Crais said then, he said, if you don't have it done, he said, it will get worse and worse. And then he put in a few technical things. What would happen, that the tumour would find its way through the bowel wall, cause a leakage of material, which would go into the peritoneal cavity and cause peritonitis. And I would die from that.
So,
well,
choice.
No choice at all. I mean,
so I said to him, I said to you then, and when we went home, I said to him, there's only one thing for you to do. If you want to live and have a good life, have it done.
That was it. I didn't look back. The treatment I had was first class. I mean, everyone was so friendly and talking and joking, and I didn't feel any apprehension at all then. I mean, I was just, they said, yeah, well, okay, you're ready now. And well, that was it. I didn't look back. I didn't have any fears of it at all. Not in the end, I didn't. I mean, it was the nursing staff and doctors that gave me all this confidence. And it was nothing to worry about.
So after the operation, you were up and about pretty quick?
Next day, walking to the toilet.
Did that surprise you?
Yes, it did. I thought, I was going to need assistance to go to the toilet, and I didn't fancy using bedpans and things, so I thought, well, I'm going to go. I was a bit wobbly on my legs, that was the next day. But I got to the toilet and came back and into bed, and no one said anything. And it was eating. It was a nice meal for you when the meals came around at night. And I didn't look back at all. I could feel the progress day by day to the 4th day. And they said, okay, you can go home.
When he came home then, he said to me, I'm not going to have the nurse. I said, no, you don't want the nurse, I look after you. So I said to him, I'll do your wounds for you.
Dressing.
Everything. So I got clean towel, and boiling water, for sterilised water, and I used sea salt, and I bathed these wounds every day with sea salt, and until I could see him dropping off great, and everything was marvellous. He was worried about having an infection, and I said to him, you won't, if you use the sea salt, you won't.
And did you?
No.
No infection at all, nothing. It just was so, the healing process, you could see the progress of it day by day until the day before yesterday when the last scab fell off and everything is
Tuesday.
pink. Yeah.
Tuesday.
So
Yeah.
how long is it since the operation?
5 weeks.
5 weeks.
And how would you say you feel today?
Marvellous.
Better than before. Because I've got more blood in my body because I lost all that amount of blood and they didn't replace it. I don't know why that was. Where they give me tablets, iron tablets to make blood, you know. But I do feel quite well.
And free of anything nasty.
Oh yes.
So
And there was
confident.
Yeah, but the nicest part of this operation was when I came around, Dr. Crais came to see me when I was conscious, and he said, there is no bag. And what was it?
No, he said your operation was very successful.
Yeah, that's right.
And he said, John, you have no bag
And no chemotherapy.
and chemotherapy. And
They'd
he
taken
said,
it out clean.
Thank you, Dr. Harry. Thank you, he said. So
I don't remember that
I
because
was there. I was there.
I was still partly under anaesthetic, but you know, I was around enough to understand what he was saying and I could talk back to him, but I couldn't remember what I said the next day, you see. And what I would say is to any patient who's got the same as what I had, get it done, because it's not going to go away. It won't go away on its own. It's got to be taken away. And if you don't do it, then you can expect the worst in consequences for not having it done.
And those wounds then would heal.
Without this lady, I could have made a recovery as I've done so far.
I'm Judith Walkley, and I had a bowel tumour 2 years ago, 2006. I first noticed there was something wrong when I went to give blood, and they said I was anemic. And so I trotted off to the GP, and investigation started over why I could be anemic, and I had a whole battery of tests. At the same time as I was at the GP, I thought maybe I'd better mention that I was having a small pain in my lower abdomen. GP didn't think it was anything. I kind of felt it was probably bowel. But it took the best part of a year before I did manage to get in for some proper colorectal examination. At which point it was, you know, it came up on the scan that there was a tumour there, and then I went into hospital and had some surgery, had a right hemicolectomy, which means that this half of my bowel was taken out, and my small intestine was joined up to the rest of my bowel. Fortunately, everything was caught early, so nothing had spread to the nerves, to the lymph nodes, to the surrounding tissues. So I was very lucky. Once the surgery was done, it was away you go and get better. It is a shocking time when you're told that you have cancer. But it was done in such a way as to be put across as something that was really nothing very out of the ordinary. It was nothing to really panic about. They were going to handle it all, and they knew exactly what they were doing, and that was how I felt. I felt that they knew exactly what they were doing. I sort of took it in stages. I thought, okay, let's get the scan done, first of all, because they take you for a scan to find out whether there's any spread before they decide exactly what surgery you're going to have. And so I just really thought as far as the scan. I thought, okay, let's get the scan done, and once we know what comes out of the scan, and then I'll think about the next stage. I was really more concerned with my schedule at the time because I had a lot going on, and I thought, can I fit this in? Which, looking back, sounds bizarre because it was it was saving my life. But I think because I wasn't focusing on the, oh my goodness, I could die, it was, I have to do this, and I also have to work because this needs to be done and that needs to be done. And I think bizarrely that kind of helped to make it not such a big issue. When it came to the night before the surgery, I remember being a little bit tearful it's kind of, okay, this is it now. And I had to hand myself over to the surgical team. But they're very, very good at taking the reins and telling you that it's their turn now. And you must just forget about everything, leave everything to us. And once I did that, it was actually quite liberating. It was, okay, fix me up. I don't have to do anything. I just have to sit here and get better. If you can try and stay away from the worry of it and, oh my goodness, what a terrible state, what a terrible thing to happen. If you stay away from the tragedy of the situation and focus on what it can actually bring to your life. An illness can bring wonderful things into your life. I never really knew how well thought of I was amongst my friends and my clients and my peers until I was ill. But I had the most love from people when I was at this low ebb, and it was wonderful. It was wonderful. I wouldn't trade it for anything. It's quite amazing, actually, how soon you start to get strong again after what you've been through. But I was in hospital for 8 days, and I didn't have keyhole surgery. I had a slightly larger scar, which is a couple of inches, hardly anything really. And I went home, I think it was 8 days, and just took it easy. The only issue when I got home was everybody said, well, eat normally. And so I tried. And you can't really eat normally because I had a resection. I'd had a bit that had been joined up, and so it was narrow. And so when you eat fibrous things like apples or fruit and fibre for your cereal, it's trying to push through a tube that's smaller than it used to be. And it had a bit of trouble getting through there. And so, for a little while I lost quite a lot of weight because I wasn't eating what I would consider to be a normal diet. And that's a bit worrying for the people around you when you lose weight because they think you're getting worse. I wasn't, I was just losing weight. And as soon as that sort of fixed itself, and it did fix itself, with a little bit of help from me, I just started to gain weight again, and within a couple of weeks I felt an awful lot better. It teaches you to look after yourself, to not take your health for granted. It teaches you to watch your diet, to do all the things you should do, and it teaches you to enjoy your life and to not worry about things because, everything in life has a lesson in it, everything, good things and bad things. Well, when you're in the office and you're being told that you have cancer and you're going to have surgery, your mind very often goes a blank. And even though people are talking to you and people are being very kind and very supportive and giving you things to read, and you can't take it in. So what's useful about a DVD is that you can go home and take your time to digest it, replay it if you want to, replay it with somebody in your family who's going to help you understand which parts of it you need to take heed of. And I think it would be really, really useful for demystifying the process and for reassuring people that, they know what they're doing up there. It may be your first time, it's not their first time. They've done it heaps and heaps and heaps of times. They know exactly what they're doing. And you're going to be in really good hands. And I think the DVD will really help that process.